Welcome to the Forward Together webinar series, brought to you by the School of Management at California Lutheran University. The series is designed to bring interesting topics and people to our global community of students, alumni, and leaders in business and government to empower, educate, and inspire. Forward Together features experts from industry with the purpose to spark thought, connect people, and stimulate engaging discussions. Please submit your questions in the chat. We will hold a Q&A immediately following the presentation.
Hi all, a very good morning to you and welcome to this webinar on responses to COVID-19 in Asia, healthcare and the economy. And we are honored to have a very distinguished speaker here with us today, Dr. Rafiq Dossani, who will speak on a very pressing issue before us, which deals with the state of health and economies in Asia, the most populous region in the world with about 4.4 billion people. So without further delay, let me hand over the floor to Dr. Dossani. And just a quick reminder that you can share your questions in the chat box. And Dr. Dossani will have about 25 minutes to speak, followed by about 20 minutes for Q&A. Dr. Dossani.
Thank you, Sabit. It's a great pleasure to be here. Thank you for inviting me and to your colleagues as well. So the reason why COVID in Asia is interesting, I think, is that the problem originated in Asia. And many Asian countries have gotten over the problem, but it's also very active in Asia. And so it's both at the leading edge of the pandemic as well as the lagging edge of the pandemic. So I want to talk about that. What can we learn from the leading edge and what can we learn from the lagging edge, and what can each learn from each other? So in some ways, this is a tale of a dichotomy of two Asias, not just one. So now to bring out some of those points, I'm going to share a screen with you. Okay, I hope you can see my screen. So what I'll be covering in this talk is first the state of the pandemic in Asia. Second, I'll talk a bit about the societal impacts, and third about what we can learn from what's happened. So as you all know, COVID in Asia is now 6 months old and counting. It was identified officially on December 31st, 2019, which is why it's called COVID-19. One day later, it would have been called COVID-20. So it's been about 6 months since the virus came into existence within human beings as a result of a random event of animal to human transmission. As with the other respiratory viruses, the intermediate carrier from the animal to the human was a bat. And the bat was responsible both for SARS and MERS before it, and also for COVID. But the key point is that since then, human-to-human transmission has readily occurred, and the virus is now active in 213 countries, international territories. Now, in most of Asia, the virus has already progressed through its different stages. Stage one being the transfer of the virus into a country via travelers, or what's called importation. Second, its transfer from imported cases to local residents in isolated clusters, what's called local transmission. And stage three, which is sort of the full-blown epidemic, which is community transmission. So to give you a sense of compared with other recent epidemics, COVID is different. So here you see in this table, I compare 4 recent epidemics. A pandemic being one that's global, epidemic being one that's confined to a country or a region. So the first one was the SARS pandemic in 2003. Second, the Middle Eastern respiratory syndrome, which was 2012-13. And then just for comparison, a non-respiratory epidemic or pandemic, which was the swine flu of 2009, and then COVID. Now, what you see in this table is in the first column, the name of the epidemic, how it came into infecting human beings. So bats in the case of the three respiratory viruses, swine in the case of H1N1. And then the third element is which country did it originate in. So China for SARS, Saudi Arabia for MERS, Mexico for H1N1, and China again for COVID. Now, the number of infections has varied greatly from just under 10,000, 8,098 for SARS, 2,500 for MERS, 762 million for swine flu, and then 8.9 million and counting for COVID. Now, the reason why SARS and MERS really didn't become serious problems was that they actually spread in a very different way from COVID. In the case of SARS, the spread was via the, you could only really catch it if you were sitting next to someone who already had it at an advanced stage. So it was possible to identify and isolate people who were already visibly suffering from SARS, which is very different from COVID, where you can infect people even though you are not showing any symptoms. So SARS, therefore, was easy to isolate through proper tracing, and then testing and isolation solved the problem. And 8,098 cases and only 774 deaths. Of course, when I say only, every death is tragic, but relative to the others. Compare that with the Middle Eastern respiratory syndrome of 2012-13, and that was even fewer. And that's because the only way you could catch it from someone who had it was through prolonged contact with someone who was very sick, such as in a hospital environment. So that was, again, relatively easy to address. The swine flu, like all influenzas, spreads very rapidly because of rapid mutations of the virus. And so actually ended up infecting a large number of people. But because it was in the flu family, for which a lot of virus treatments were already identified and found to be effective, an anti-vaccine was developed in just 11 months. As you can see from column 4, the vaccine was found by November 2009, and just a few months after, about 10, 11 months after the virus broke out, with the result that deaths were controlled. So most of the deaths had already happened by then, 284,000 deaths. And now we come to COVID, which has infected 8.9 million people. It's now been about 6 months. We do not yet have a vaccine or any other form of treatment for the drug, for the infection. It's affected 213 countries and territories, caused 465,000 deaths. The last column is just to try and get a sense of the economic impact. So world GDP really wasn't affected in any way by the first three. As you can see, there was positive growth after 12 months after SARS and MERS. In other words, no effects, and that's not surprising. The swine flu apparently had an effect, but most of that minus 1.7% global growth negative that you see in this table was really due to the financial crisis of that time, not due to the flu. And then you see COVID and the world and the forecasts of declines driven by COVID of minus 3%, but probably worse once we get down to it. Now in this table, what you see is the progression of COVID. So focusing just on COVID in this table, what you see is that this is data taken out 2 days ago, so it'll be slightly different from today's information, that globally there are 8.9 million roughly cases, 8,856,274. It's been growing over the last 3 days at a rate of 1.7% a day. In parentheses, you see 1.2%, which was the rate of growth a month ago. So just towards the end of May, early June, I took out the comparables. And I find that the growth rate has accelerated from 1.2 to 1.7%. So has the death rate. If you see the last column in this table, it's gone up from 0.5% a day to 0.9% a day. Now, Asia is worse than, so if you look at the second row, you can see that Asia is not doing as well as the rest of the world. So 2.3% growth in infections, 2.1% growth in fatalities. That rate has also been going up over the last month. Now, if we try and pinpoint where in Asia the problem is most severe, you can see that South Asia leads in infection rates, growing at 3.7% a day, more than the Asian rate. And the death rate is growing at 3.2% a day. East Asia, we're almost at stasis, so 0.1% growth in infection, 0.0% growth in fatalities. Other Asia, that is Southeast Asia and West Asia, mainly Southeast Asia because numerically it's more dominant. It's kind of in between East Asia and South Asia. So if you look at it, there's a continuum. If you look at it from East Asia, where the problem began, now mostly gone away, growing as you go through the rest to Southeast Asia and then peaking in South Asia. So there is a continuum, but if we focus on South Asia and East Asia, you can see this being a tale of two very different Asias. So let me talk a bit more about that. Before I do that, and to understand the societal impacts, we need to understand a bit, I believe, about how to control the disease. So the disease can be controlled at three levels. One is you can try and control the virus from infecting anyone before it enters or the human host. You can talk about controlling the virus after it infects somebody. And third is as a preventive, so a vaccination. So if you can get any one of these right, control the virus, control the host, or control the environment, the epidemic comes under control. So let's talk about each three in turn. The first is controlling the virus by finding a drug to cure it if you happen to get infected. That's typically through an antiviral injection. So there are several drugs being tested for this, about 2,000. The most prominent you may have heard about, favipiravir and remdesivir. Both were developed for other purposes, favipiravir as an anti-flu, remdesivir as anti-Ebola. They were only partly effective for their stated purposes and not in significant use for those purposes anymore. The good thing is that because they were tested several years ago, their safety profile has been established. So in formulating a drug, there are several stages to be gone through. Just a second. The first stage is to establish the safety of that medicine, and that has been done. Then you have to test it out through various clinical trials for its stated purpose, and that's what's going on right now. The good thing about COVID is that it has a low virus mutation rate with only 20 or so mutations identified to date. So unlike the flu virus, which mutates constantly and there are millions of mutations out there, it looks like COVID is very different from its structure. And the same was found with SARS and MERS, which means that you might be able to find ultimately an antiviral that works. If it mutated very quickly, it might have been more difficult to do that. And that applies to vaccinations as well. So it's more like measles, which mutates very slowly. That said, I think one should caution against high expectations of an early cure for the virus. I was talking to George Sigula, who used to head President Reagan's Health and Human Services, about three and a half decades ago. And he mentioned to me that when he took office, he was suddenly faced with the outbreak of a virus that had never been seen earlier. And the person who broke that news to him was someone who's in the news these days, Anthony Fauci, who was President Trump's head of infectious disease control. Those days, he was a young person working at CDC, the Centers for Disease Control. And they had never seen the AIDS virus. That's the virus that they were talking about. That AIDS had suddenly appeared on the scene and there was no known cure. At that time, George Sigula asked what are the prospects of an antiviral being developed or a vaccination. And he was assured by the Surgeon General, C. Everett Koop, that there would be a cure for AIDS, either a vaccine or an antiviral, within 18 months. Well, fast forward 35 years and we still do not have such a cure for AIDS, although there are other things that have been found to be effective. So I would caution against high expectations of a cure. The second way to control the disease is through a vaccine. And as I mentioned, low mutation rates like the measles improve the chances of the long-term success of a vaccine. There are currently about 150 vaccines, again, under clinical trials. But again, one should caution against high expectations. Respiratory viruses are notoriously difficult to develop vaccines against. The only one we know of is really whooping cough or pertussis. There are no vaccines for prior coronavirus epidemics. Of course, this may have been because they were not a problem for too long, so there wasn't as much research. But the reality is, at the time, there was a lot of research and yet nothing has been found. So again, I'd caution against high expectations. And the third way is to control the environment. That's what every country is doing, but that's all they have available. And that's done first. You can, in the short term, you lock down whatever you can, either through voluntary or mandatory lockdowns, and then put in place through public health measures and an extensive tracing, testing and treatment procedure. This was initially a problem in many countries due to a lack of testing equipment. That's been addressed in many countries. It remains a problem in many countries. And then long-term, after the short-term cases, help you to control the number of infections to below 50 new cases a day, you can open up but establish mechanisms for high-risk areas, such as airports. And you know that localized lockdowns will occur and you have to be able to take care of them. For example, Beijing recently had the case of a local outbreak, and that's now been controlled, but it required, again, a massive closure for a few days, extensive public health measures of testing, tracing people who are infected, tracing their relatives, and so on, and finally control. And then the other mechanism, which really is not being tried, except maybe in Sweden, although even there they are now changing from that situation because it didn't work, is let everyone be exposed, let the population acquire what's called herd immunity through exposure, and then really knock it out fully when a cure or a vaccine is developed. This is very high risk. We do not know the cost of interim exposure, whether you need 70% or 80% exposure to ensure herd immunity. Nobody has a sense of those numbers. So that's something that countries are not trying. So now turning to the data, what you see here is 4 tables or 4 figures. Here I look at South Asia, which you might recall is a high incidence area as compared to East Asia, where the problem has been mostly controlled. So Bangladesh, India, Pakistan, and Sri Lanka, what's similar between them is that they all went through lockdown at roughly the same period, towards the end of March. Now the difference is when they entered stage 3. In the case of Bangladesh on May 2nd, in the case of India on April 7th, in the case of Pakistan on April 21st. So within a month of each other. But then when you look at Sri Lanka, you see the graph looks very different. They never actually got out of stage 2. So it still remains at the stage of local transmission. They have not gone into community transmission mode, which is why when you look at the increase in the numbers, you see very different numbers. You see sort of a huge increase in Bangladesh, India, and Pakistan in kind of a sustained way. And these are really very concerning because it looks like, other than South America at this point, particularly Brazil, these are the 3 countries where the virus is most active and uncontrolled. And we can talk a bit more about the details. Sri Lanka was able to control the virus very quickly, and it still remains in stage 2. Now compare that with East Asia. And here you see the figures for China, Japan, Korea, and Taiwan. And here you see much greater similarity between these countries. the problem was addressed fairly quickly through very effective measures. But I would argue that the measures were largely the same even in South Asia. The difference between South Asia and East Asia was the effectiveness of government. Government was trusted, it brought out much more resources to bear, and it worked very quickly and nimbly. And so the results were different. As you can see in this table, here on the left, you see a picture of people going out in a train in Taiwan. And on the right side of this slide, you see what worked and what didn't work. And what you can see is that in China and Sri Lanka, the lockouts were mandatory. In Japan, Korea, and Taiwan, they were voluntary. Businesses closed partially in the case of Japan, fully in the case of China and Sri Lanka. And Korea and Taiwan, they kept open. There was a travel ban in all countries. Now, why did it work in these countries? Mostly in East Asia, but one Sri Lankan example, one case of South Asia, Sri Lanka. One is the use of tracer applications. On your phone, you are required to download applications that allowed the health authorities to keep track of where you were, so that they could quickly isolate you if you were found to be infected. They could go back in time and see who else was around you and go and contact them. This was helped by having a national health database, which we don't have in a consolidated way in the United States. There was a large base of community healthcare workers to follow up. And there was adequate testing equipment, PPE, personal protective equipment, and hospital equipment. Now, these were problems in Central and South Asia. The apps were either not available or not used properly. There's no national health database, inadequate equipment, lack of a transparent, effective, and agile government. And competing, one has to recognize that South Asia is much poorer, and so the economics and the health sometimes conflicted, although I would argue that that's a false conflict, in the sense that you can see in the case of Sri Lanka, a very poor country that managed to control it and did not have to face that choice between economics and health, because during that lockdown period, which all countries went through, they were able to control it. Had India, Pakistan, and Bangladesh been able to use the lockdown period effectively, they too would not have faced that choice between health and the economy as they now face. So the economies are going to be badly affected. You can see these growth forecasts, compared with 2019, all positive now, pretty much all turning negative. So the chances of a V-shaped recovery are limited. If you look at East Asia, similar situation, China, Japan, Korea, Taiwan, all of them showing sharply declining rates of growth for 2020. And so we're looking at a difficult situation going ahead. And we're, I think the problem is particularly acute for South Asia, but there's much to learn from the differences in their experiences. So let me wrap up my presentation with the learnings. One is from the Asian experience, we can learn because the problem started in Asia, has ended in some parts of Asia, it's raging in other parts of Asia. There's actually much more to be learned. Asia therefore offers a microcosm of what's happened that much can be learned from. So one of the learnings is we do not know enough to be able to safely control the environment and open up the economy at the same time. As a recent Beijing experience showed, you're going to have localized breakouts and then you have to take quick action. So many countries have chosen strategies that fail to control infections. As reopenings occur, many will fail to stop a new outbreak. If that happens, localized lockdowns will be needed when cluster outbreaks occur. At this stage, we do not know how frequent or widespread these will be, but it could hobble economies and societies at large in ways we have not experienced. I've kept mentioning how important trust in government is going to be, and equally the government needs to trust the people. So Korea could hold a national election, for example, in the middle of its lockdown, its epidemic, never had a lockdown, but in the middle of its stage 3 on April 15th, in which 66% of the public voted, some by mail, but mostly at the polling booths. And this was possible because not only did the public trust the government that there would be adequate measures to protect them at the polling booths, but even afterwards if there was a breakout of infection. And the government trusted the people to form the lines properly, not go out if they were ill. And what we found that subsequently the infection rate did not rise. So it showed that if you have that trust in government and the government trusts you, there are many things that are possible to be done. I think that's been a huge problem in other countries. Next, since neither a vaccine or a drug is likely soon, life as we knew it will not return in a hurry. Some form of distancing will continue for everyone. But East Asia's reopening, now several weeks old, is encouraging. And I'd particularly again like to point out Sri Lanka, which shows that control is possible in poor societies. Very important. You know, all the examples we read in the media of societies that have succeeded that are rich, you know, New Zealand, obviously the countries in East Asia. But Sri Lanka shows that control is possible in poor societies because you can at costs that are reasonable. All you need is the right approach and the right trust and activity of the government. But coming back to, and as an economist, I guess I must end on a dismal note, the prospects for an early and quick economic recovery remain low. We are going to live with the impacts of COVID for some time to come. Thank you. That ends my presentation. Sabik, may I hand back to you at this stage?
Thank you, Dr. Dossani, for a very insightful and quite wide-ranging range of issues you covered there. We have a few questions that have come in, so I'll take those first, and then I may have a question or two depending on the time we have. So 2 questions which are coming from 2 different people, but they speak to the same issue here, which is about the reliability of data from governments in Asia. So would you like to speak to that a little bit in terms of how reliable is the data coming from, say, Chinese government or other Asian countries? Because that I think is important in mitigating a lot of the challenges that you mentioned.
Yes, I think I assume the question is referring mainly to China. I have not heard of data unreliability for the other countries of Asia.
Right.
Maybe some of the poorer countries are hiding the data. Say North Korea is reportedly hiding data. Maybe state governments in India, to look good, some of them are reported to be hiding data. But
sure,
I'm assuming that the big news that's made the US media has been allegations that China is hiding the data. And actually just a couple of days ago, there was a report put out by RAND, the organization I work for, looking at air traffic movements, suggesting again that there was some hiding of data by China. I think China certainly delayed reporting the virus. Now, arguably that could be because it had never seen the virus before. It was something completely new. You can see in the US how slowly we reacted to the news from China, and that was after knowing about the virus. So, I mean, you could make arguments as to whether China could have done better in the initial stage or not. I think the real question is whether later on, in a meaningful, substantive way, they hid the data, they hid the virus. There's no evidence that there were large infections that broke out either in China or globally as a result of that. You know, I mean, if you look at it, say December 31st was when the virus was identified by the World Health Organization. By early January, countries could have put measures to travel in effect, control measures. China itself did so on January 23rd, but Taiwan did that on January 2nd. So it is possible that, you know, countries should have taken their own measures and not relied on whether China was telling the truth. But even if you look at Chinese data, had they hidden it in a big way, the problem would have been harder and harder to hide as the days passed by. There's no evidence that the problem has expanded in any uncontrollable way since. So if anything, the problem has come under control, as you saw in the figures that I showed. You know, and there would have been some measures, say mass graveyards and so on, that really very, very hard to hide. So on the whole, I tend to, having read a lot of the information, tend to feel that China, after the first few weeks in December, really did not hide the numbers.
Yeah, well, thank you. That's helpful. And also, just to add to what you're saying, also the involvement of WHO, World Health Organization, and other international organizations potentially brings that level of transparency, right?
Yeah. In fact, that's a great point because,
Yeah.
President Trump has complained about WHO,
Mm-hmm.
but in fact, the team that went to China included Americans who were part of WHO and who were responsible for reporting back to their home countries.
Right. And on that, Dr. Dossani, could you talk a little about WHO's involvement in other poorer countries and the kind of expertise that they bring to the table, which those countries may not necessarily have?
There are countries, particularly the very poor ones, such as in Asia, in Africa, which rely totally on the WHO as a source not just of knowledge about how to manage the public health interventions,
Mm-hmm.
but also ultimately for disease control and for funding that disease control. So WHO's role has historically been very significant, even for developed countries. I mean, every year WHO will announce and make available the flu vaccines because the vaccine mutates so regularly, you can't use the same vaccination every year. So the new vaccination every year that CDC in America uses is based on the vaccination profiles and protocols announced by WHO.
Mm-hmm.
So its role is absolutely critical.
Sure. Thank you. A related question on Central Asian countries. Is the data there, again, related to reliability and also the kind of authoritarian regimes that exist in Central Asia? What is your sense of how's the data coming out there? Do you think governments there are doing a fairly effective job?
Yeah, that's a really good question. I took out some data on Tajikistan to see if the virus profile was growing as expected. It's not.
Mm-hmm.
And they tend to be under the radar screen because their populations are so small.
Sure.
And they're geopolitically not really in the center of things the way that China or Taiwan are. So there might be, but I haven't looked at it in enough detail to say that this is actually happening or not happening, but it could well be.
Yeah. So what sources would you point to if someone were to independently look up Central Asian countries? What sources would they go to?
So the best source for data is the European CDC.
Okay.
So it obtains data from the WHO and other sources, and every day publishes a global record of the virus cases.
Mm-hmm.
And that data is relied on by a number of sources, including Johns Hopkins in the US, Worldometer, things that we are easy to read, but it's just right now a 1 megabyte file. It'll grow with time.
Yeah.
More and more cases come in. But that's one of the good data sources. I think Oxford University and Johns Hopkins have both done a very good job of making the data available in a very easy to use way, although they don't keep good quality historical data, but current snapshots are available.
Okay.
And in terms of the public policy intervention, that's a little more difficult. I think that's where there's a gap. I want really to get, in researching for your presentation as well as for some other work, I wanted to look at what different countries have done. And really, there's no single source where that information is available. You have to go country by country, do a lot of reading to understand their interventions and the effectiveness of their interventions.
Absolutely. Another question on how long will it take for life to become normal? It seems like cases are going up with different businesses opening up across the US. So
I think for this year, at least, we'll have to define normal as something else. It's not going to be as we knew it. At the end of the day, the feeling of not being in control of the situation will last until there's a cure or there's a vaccine. And as I pointed out, I think, at worst, the vaccine might take a long time. As I mentioned about AIDS, there's no vaccine. Other coronaviruses, no vaccine to date. Flu, there is a vaccine. There are many vaccines for other viruses as well. It's really tough one. I mean, until that comes back, there will not be a sense of control of public life, and we will not be able to get back to normals. And if that's a year away, well, or a year and a half away, that's the reality of time that we'll have to face. Now, how do you then adjust to that? What can you do? Can you recover economically? Again, I think East Asia is interesting. As you saw in the data I presented, the recovery is going to be very slow. But if you look at activity, there's much more of a return to normal activity. So, for example, in Taiwan, socially, people are going out, restaurants are full. They have all their measures in place. People, again, it's a matter of public trust in government and government's trust in the public. I would say China as well, probably and this is backed up by Google Earth photographs of activity, particularly nighttime activity. It looks like they're back to about 80% of normal activity, which is very encouraging. So,
sure, absolutely. I realize you're not a public health expert, but one of the questions is about why is it so hard for vaccines for respiratory diseases? I was wondering if you have any thoughts on that.
I'm not the expert to talk about that, but I understand that from whatever I've read, that the structure of the virus itself makes it very difficult to break the virus through a vaccine. So, and which is in a way a good thing for us also, because that's also why the virus doesn't mutate much. It's basically interested in protecting its original composition. And so does not mutate, but it does mean that it's harder to break down.
Sure. This question I'm asking on behalf of my students in my public administration and theory class. Looking at the kind of regimes that are, we're talking about, some of them are democracies, some, a wide range of countries, authoritarian, some are democratic. Do you think one can generalize and say certain kinds of regimes have dealt with this issue better, or does the regime type matter, is my question?
I think that's a really interesting question. Initially when China reported late, people blamed the regime type as an authoritarian regime, that it could hide information. Subsequently, its ability to rapidly control the situation was again attributed to regime type thing. As an authoritarian regime, it could very quickly control the situation. But then we started seeing other cases in East Asia, some in, outside East Asia, in countries like Vietnam and in New Zealand, where they were able to control the virus quite effectively in two different regime types. In New Zealand being a democracy, Vietnam being authoritarian. Sri Lanka is a strong democracy. They were able to control it. And on the other hand, you had democracies like India, Pakistan, and Bangladesh, where they were not. So the economics can't be factored away. I think it will be a mix of regime type, economic status. But I think more important is the level of trust. I think that can happen whether you have an autocracy. So the regime is trusted, as in the case of China, that, end of the day, their legitimacy relies on their ability to control these things effectively. And then you have countries like Pakistan, India, and Bangladesh, where the quality of trust in government is really, really low. And the government, unfortunately, reciprocates. I don't know if you caught it on one of the figure on India. I mentioned lockdown / migrant exodus.
Sure, yeah.
There are 100 million plus migrants within India. These are Indians working in different parts of the country, largely men away from their families, but not only that. And the government didn't give them any time when they announced a lockdown to rearrange their lives. They said they gave them just 4 hours. So you had hundreds and hundreds of thousands of migrants suddenly faced with the reality that they could no longer make a living where they were, and they would have to go back to their villages. And so they began a trek home, because the government had officially shut down. They weren't going to provide public transport. People walked hundreds and hundreds of miles, in some cases over 1,000 kilometers, I've read, to get back to their villages. Now, what kind of trust does the government have in its people if it does a thing like that?
Absolutely.
So
that's one of the more tragic.
I'm saying the two-way trust is absolutely key if this is to work, and by contrast, the situation in Korea where they could hold a national election in the middle of the pandemic, right in the middle of stage 3, and everyone turned out.
No, absolutely. I think that's a very important point. And I think the trust in institutions is key to solving these issues as well. And the kind of decisions and deliberate planning that goes into addressing very complex issues. Absolutely valid point. A question which is in your wheelhouse about the economy. So this question is also, are we going to see a market crash in stocks, real estate because of COVID-19? Would you like to talk to that a little bit?
I assume the questioner wants to know about the US markets more
potentially,
than others. The US market, I think the government here did a very wise thing in terms of completely opening the taps on liquidity and jobs. So the result was the sustainability to the economy that had been completely unexpected. Most people were predicting a sharp downturn, which did not occur. And that's continued till date because those payouts are continuing. The PPP program is still active. So that's the good news. It would succeed and prevent any big crash because money is now very cheap. If we can bring the virus under control in the way that East Asia has. And this is the problem, that we have to ask ourselves, what did the lockdown financed by expensive public money, 10, 20 to 25% of GDP, much, much larger than anything we've seen before. By comparison, the financial crisis of 2008-9 used public funds to the amount of about 5 to 6% of GDP. And here we're using 25% of GDP, perhaps more, if you add Fed support, all of it monetized. What has that bought us in terms of controlling the disease? The evidence is not encouraging. I mean, the resurgence of breakouts at a level that we had not expected is not encouraging. And so, unlike in East Asia where the lockdown, whether voluntary or mandatory, was purchased by public money, it was a good purchase because within that time they were able to bring the virus under control. That has not yet happened in the US. Now, there are dissenting voices saying that it is under control. This is not a phase 2 of the virus. It's just due to testing. I think there is some validity in that, but overall, I would say that the US has not succeeded to date in bringing the virus under control. If I'm right, and if the breakouts continue, then the economic impacts would be severe and the market will certainly look overpriced.
I think that's a scary prospect, but looks like things might head in that direction. We have just time for 2 more minutes and maybe one final question, and I'll take that from the Q&A that's coming. Has Sri Lanka shared their methods for success with other developing countries?
Yeah, great question. I've been in touch with the government, working directly with the Director of International Relations in the President's office to try and get them to inform much more about what they have done. So I have a fair bit of information, but my sense is they haven't really made public. They're very, one of the things they did very well was their public health worker system, which is spread out throughout the country, that every time a case was identified, the public health workers went to that person's house, interviewed the person, found out whoever they had met over the last several days, matched it to their national health database, contacted every single person who had been met by the infected person, tested them, isolated them and their families, and controlled the breakouts. This is exactly what the successful countries in East Asia did, except that whereas there was more use of technology, they'd contact people over the phone in Taiwan. In Sri Lanka, they just fanned out and did it person to person to make sure that nothing was slipped. So I think that approach was very effective in Sri Lanka, and this is something that poor countries can do. One of the resources that they have, which is very cheap, is a large public health worker system. In the millions in the case of India, for example, and so through the ASHA system. So that's something that I think is worth learning from. But no, in terms of documenting them as a case study, it's something that I think very much needs to be done.
Absolutely. Absolutely. Thank you, Dr. Dossani. We have a few more pending questions, but unfortunately we're out of time. And for those questions, I think I'll collect them and probably send them to you by email, and we can have them answered at a different forum. But I want to take this time to thank Dr. Dossani for spending this time with us, and also for all the participants. This has been a very, very rich discussion, and we hope to see you all, the audience, in the future. Check out our website, callutheran.edu/forward for the upcoming webinar series. And in the meanwhile, please stay safe, and be in touch. Have a good day. Thank you.
Thank you.
We thank you for participating in today's Forward Together webinar series, brought to you by the School of Management at California Lutheran University. The School of Management offers a broad range of programs and community services. Whether you're looking to upgrade your career, locate current economic data from our Center for Economic Research and Forecasting, or a place to start and grow your business at Hub 101, our community startup space, we invite you to visit us at clu.edu/SOM and join the community as we move forward together.